All right, guys, with me today we have Zach Long, the Barbell Physio. Some of you may know him from his large following on Instagram. He is a physical therapist, educator, and strength coach that has done a lot in the physical therapy world. So, Zach, thanks for taking the time today to come on here and discuss some things about CrossFit and strength athletes and barbell athletes and all the like.
All right. Thanks for having me. Glad to talk.
Yeah. So, Zach, I was curious, what is your mission of what you're trying to do as a physical therapist, educator? What is your mission in life here with all the things you're doing in the physical therapy and strength and conditioning industry?
I think we're at a stage in the medical world where we need a healthcare profession that is looking at taking people from being sick to well to fit. So that's the sickness, wellness, fitness continuum that CrossFit talks about quite a bit. But so much of the medical world is focused on, this person's blood pressure is too high. Let's get it down to a manageable level, and then we're done. And they don't try to get people even further away from that. Or if we're talking about somebody that's dealing with like a knee tendon, for example, it's not just about getting that tendon back to as strong as it was prior to it got injured. It's about making it stronger than it was even before that injury, so that it can long-term tolerate a lot more training volume and intensity and that sort of stuff. And that's, my mission, our mission at Onward Physical Therapy that I'm partnered with, and ICE Physical Therapy that I'm partnered with in terms of teaching continuing education, is how do we get clinicians that care about more than just taking care of somebody's pain, helping them
Awesome.
reach their long-term fitness and health goals.
And so I'm curious because you've educated a lot of physical therapists in the industry now
Yep.
with ICE. And so with you guys there, what are the things you guys see that are issues or things clinicians are missing that their patients are missing out on because people don't have the education in these types of strength and conditioning modalities?
I think there's probably three things that people are generally missing. Number one, we don't discuss lifestyle factors near enough with our patients. We're not talking about how they're sleeping, what their nutrition's like. Are they getting enough protein intake to support the amount of physical activity they're doing? Are they managing their overall stress levels? All those lifestyle factors just tend to get put to the side, and people tend to focus way more on just technique or a muscle not activating or something being tight or things like that. So number one, we got to get after lifestyle factors. Number two, I don't think as a profession, we're good enough in the physical therapy profession, we're good enough at analyzing human movement. We never kind of stop and come up with like a process of how do we break down a complex movement pattern when somebody has issues with that, which is a giant hole in our game, especially if we're going to promote ourselves like the American Physical Therapy Association has, as like the movement experts in the medical field. If we're going to be that, then we better know how to take complex movements and break them down. When somebody has pain with their snatch or with running or with a barbell back squat, like it's not just jumping on a treatment table and pulling our goniometer out and looking at how much hip rotation they have and shoulder rotation they have. It's, can we actually stop, look at that movement pattern, and then coach them into better positions? Then get on the treatment table and look at how different joints and muscles move and come up with a much more complex overall picture of somebody's movement to help solve those movement related issues. And then the third component to that is when we kind of know what's wrong with their movement, or we know what tissue's injured and we decide that we need to make that tissue stronger or that human stronger, we then don't have enough training in terms of how do we actually properly dose human beings to create an adaptive training response. So we're stuck in the world of bird dogs and clamshells and transversus abdominis activation stuff, and we don't do enough things that actually create truly stronger, healthier, fitter tissues.
Absolutely agree with that. So when you guys, from the I guess ICE perspective or onward too that you work with, um, do you guys kind of reverse engineer like a typical evaluation for someone that's an athlete, where you're looking at complex compound movements first before you start dissecting movement? Sometimes.
So the thing that's always going to impact where we start is somebody's irritability. So if a patient comes in and let's say that they tweaked their back on deadlifts the other day, they're now coming to see me. If their pain is, a 7 out of 10, by the time they drive from home to the clinic, that highly irritable pain, I'm not going to immediately throw them underneath the barbell. Instead, I have to respect that irritability. It's going to take a couple of sessions for us to calm stuff down enough that we can get to the barbell and start looking at their technique and rebuilding that movement. If somebody comes in with low irritability, so let's say They say that, every time I deadlift, I tweak my back. It's a 3 out of 10 for a couple of days, and then it's back to normal before I deadlift again. And it actually takes a heavy load for their back to get irritated with those deadlifts. So we know that that irritability is really low. Then that's somebody that, I'm going to reverse engineer that. I'm not jumping them on a table at the very start of our objective assessment. Instead, I want to look at their deadlift really quickly in that session, work on coaching them through different things from a positioning standpoint. And then we can look at mobility breakouts. We could test specific muscles or areas, things like that. So irritability drives all of our clinical decision-making process.
Makes sense. And so you guys are big in the CrossFit world. You obviously have a big CrossFit following, and I think you participate in CrossFit yourself. There's so many different things I've seen about CrossFit, whether it be good, bad, ugly. You've probably seen it all as well. And I think CrossFit is great for a lot of people, and it's changed lives of many people, but there are still things people can do to get hurt, just like they can in any other gym or workout setting, or even going for a small hike. So, for the 45-year-old that's, the average Joe that's looking to join CrossFit for the first time, what are some things they should be worried about or red flags they might want to look for in a certain gym when looking at the coaching, the programming, what the coach might want them doing, etc.?
Okay. So first, from an injury perspective, I think it's important to note that the research does say that injury rates in the CrossFit athlete are no different than other forms of recreational fitness activities. So you're not 10 times more likely to get injured if you're CrossFitting compared to powerlifting. But there are a few things that I think are really important to look at, like if you want to overall significantly reduce your risk of injury. Number one is understanding your previous injuries and how that relates to the movements that you might see in CrossFit. So one research study looked at CrossFitters that are new CrossFitters, and they looked at their injury rates, and they found that new CrossFitters get injured 9.5 times per 1,000 training hours, compared to experienced CrossFitters get injured less than 3 times per 1,000 training hours. So quite a bit more. But when they went back and they said any of those 9.5 injuries that related to a previous injury, let's exclude those, injury rates actually ended up evening out. So there wasn't a big difference between that. So what that means is if you have an area that has previously had issues, we need to be aware of that. And we need to work with somebody that's qualified to help us understand how to look at that pre-existing or previous injury and the movements you're going to see in CrossFit and how to really have the right things dialed in. So if you have shoulder instability, for example, like if you have a history of you had a labrum repair 5 years ago and now you want to get into CrossFit, you might still be somebody that's prone to shoulder instability type pain. And so we need to work with a therapist or a coach or a gym that can then help you really dial in your kipping mechanics, your strict gymnastic skills, your snatch and your overhead squat, the different movements that would really challenge shoulder stability. We need to understand how to be there for that specific individual. Beyond that, then we kind of look at, in general, what are the things that are really important from a injury risk perspective. We do know in other research studies that individuals that train less than 3 days a week of CrossFit and more than 6 days per week of CrossFit tend to get injured more. So the sweet spot is somewhere between 3 and 6 days a week of CrossFit. When you go more than that, your body just doesn't have time to recover. When you go less than that, you simply just don't see the movement patterns frequently enough to build up tolerance to those movement patterns and capacity in those movement patterns. So you might not see a deadlift but once every 3 months if you only go to CrossFit twice a week. And so you're going to show up to a workout that maybe has really heavy deadlifts for a high amount of volume, and you've never really spent the time developing your technique or capacity there, and that can result in injury. So 3 to 6 times per week is going to be your sweet spot. Class size is really important. That's one of the big red flags I have. The research says that lower class sizes results in less injuries in CrossFit, which makes sense. Like more coaches means that you're going to have more or less students per coach, means that the coach has more time to go around and make sure everybody's doing the appropriate scaled version of that workout, that they understand how it's going to go, that they understand what technical cues they need to be focused on as an individual. And then the next thing I like to look at is the overall volume that we see in a CrossFit workout, in a CrossFit class setting. So there's a big trend right now towards CrossFit gyms really jamming more and more into that 1 hour long CrossFit class. So they have a warm up, they have a strength piece, they have a skill piece or gymnastics piece, and then they have a metabolic conditioning piece. And when you time all of that out, that's so much stuff jammed into an hour that what they don't end up having time for is coaching. And so the coach doesn't have time to go around and check in on those 15 athletes in the class and say, oh, Sally, on today's workout, you probably shouldn't be doing bar muscle ups because it's a huge volume of bar muscle ups and you just got your first. Today, I want you to practice X, Y, and Z skill in that vertical pulling component of the workout. Or Jimmy, I know last month you dealt with that back thing. You've been doing really well, but today's workout is super back intensive. Let's sub this exercise for that, or let's drop this weight down a little bit. Just makes the minor little tweaks to the workout that's going to help those individuals be as successful as possible. That can't happen when we have too many people in a class or too much overall volume in a CrossFit class. So I think those are the big hitters.
Mm-hmm. And for, again, probably the average Joe or someone new to it, or that has had some common injury like shoulder instability or anterior, front-sided shoulder pain for those that you were avid listeners here, or hip impingement. What are the biggest maybe injuries you see, or certain movements that can cause people injuries?
I think the biggest movements that cause people injuries, and so I treat primarily shoulder and hip issues. So I'm going to be biased in that, and that the biggest aggravating factors I hear from individuals are squats when they're talking about the hip pain. From a shoulder perspective, I tend to see a lot more people that get shoulder pain with gymnastic skills when they're doing muscle ups and high volume kipping pull-ups and things like that, when they're doing them at volumes and skill levels that are a little bit above what they're actually prepared for. So there's too many people that jump into these higher level gymnastic skills prior to having kind of their baseline movement patterns perfected. So like when you were born, you didn't start running day one. You learn to sit up, then you learn to roll, you learn to crawl, you learn to walk, you learn to run. There's these developmental progressions that happen. It's the same with high level gymnastic skills. So we're not doing bar muscle ups until we can do strict chest to bar pull ups, and we have really good kipping mechanics and all different things like that. So you want to make sure you follow a good progression of building up your foundation prior to jumping into those high level skills.
Yeah, absolutely. And something I heard from someone else was like, it can take a gymnast sometimes up to a year or so to learn how to do one kip to get to the bar. And they really only do one kip, and it's to get on the bar. So, what are your thoughts on that with the volume, especially with things like kipping pull-ups for CrossFit, and you being a physical therapist and kind of being able to be on both sides of the ball of someone's going to the gym and they're doing some timed workout and there's a ton of kipping pull-ups and ring dips and things like that. What are your thoughts on that?
I mean, with anything, you can always overload any volume. I mean, I can make you do 5,000 glute bridges today. I think glute bridges are an absolute, super low level exercise that doesn't belong in most of our patients' home exercise programs because it's not aggressive enough to drive an adaptive stimulus, but we could still program too much volume of it. If I had you do 5,000 glute bridges today, would your glutes be incredibly sore? Would your back maybe wake up tomorrow a little bit tweaked? Sure, because we can overload any movement pattern. I'll say personally that I actually think that high volume kipping pull-ups are wonderful for the shoulder when you have great mechanics underneath it. And I'll say when I take periods of time, maybe off from CrossFit to focus on other things, like I've taken a couple times in my CrossFit career, although it's not that impressive of a career as an athlete. When I take little breaks and maybe focus on my powerlifting or Olympic lifting for a short period of time, I notice that the lack of kipping pull-ups in there makes my shoulders feel a little bit stiffer, a little achier. When I start throwing those back in, I feel better. I think there's something beautiful about like being able to control that fast dynamic movement for a lot of volume. That if you have good mechanics behind it, it's really good and healthy for you. But of course, you can always overdo it. Like if somebody, like the workout Murph's about to show up Memorial Day. So we're 8 days out at the time of recording this from Memorial Day, maybe more than that. That workout has 100 kipping pull-ups in it. That 100 kipping pull-ups for me is not a terribly high volume workout, but in the past that would have been too many pull-ups for me to do in one workout. And so had I, been somebody that was only doing workouts with 50 kipping pull-ups, and all of a sudden I showed up on Memorial Day to do the workout Murph, and I went from averaging workouts of 50 to doing 100, then that's a training volume spike that I may not be prepared for.
Yeah, makes sense. And I see you actually post a lot about kipping pull-up progressions and muscle-up progressions and everything. And if you're getting into CrossFit and you don't know about the Barbell Physio here, he has a ton of awesome content on his page about progressions to get you to where you want to be with it, and someone to definitely check out because he has a ton of information on there. So is there a certain component of a kip that can get people hurt? Because it's something I hear about a lot from people that aren't really savvy and maybe a little bit naive to how CrossFit works, just how general strength and conditioning, programming, volume, etc. works. So, is there a specific component you look at and find that maybe this person got hurt because they were missing some aspect of that lift or
I'd say
those
probably
lifts?
the biggest thing that I see, actually, before I say that, in terms of developmental progressions, you can find me on social media, but if you go to the barbellphysio.com or performanceplusprogramming.com and you search for almost any movement pattern, you'll find a progression of exercises to help you, any movement pattern in CrossFit, to help you get to that movement. Um, but the biggest thing that I see with people's kipping pull-ups that I think tends to lead to shoulder injuries is people that use their hips too much to generate the kip. So when we do a kipping pull-up, we're hanging from a pull-up bar and we're going between what we call the hollow and arch positions. That's global flexion and global extension. And we really want that to be driven from the core and the shoulder. So we're opening and closing our shoulder angle to create a little bit of horizontal momentum that we then translate to vertical movement. When people use their hips too much, and instead of taking their back and going into a hollow position where their lats engage and close their shoulder down to an arch position where their spine opens up and their shoulders open up, if they pike, if they flex and extend their hip back and forth, they'll end up penduluming back and forth underneath that pull-up bar because their hips are generating all this motion, and it leads to them not staying centered underneath the bar. And that pendulum ends up putting a lot more force on their shoulder, and they'll be a lot less in control of that. It's probably a little bit hard to visualize as we're talking through it on a podcast. But again, if you go to my website, you can find some videos where I show good examples and bad examples of that. That would probably be number one. And number two, secondary to that, is probably lack of shoulder flexion mobility. So if you come from like a bodybuilding world, you probably did two exercises in terms of vertical pulling. You did pull-ups, but you probably did those with like an arch back and your knees bent, which is very different from a hollow body pull-up that we would use in CrossFit. That's a bit more gymnastic specific. And you did lat pull downs. Neither one of those typically take the shoulder into a full 180 degrees of shoulder flexion. So when people jump into CrossFit and they don't have great mobility in their shoulder and they try to jump into these higher level gymnastic skills, you'll almost see them as they go into that arch position. It's like they run into a brick wall and their shoulder like really quickly stops moving. And you'll then see their shoulder very often rotate in and their elbow bend, and they'll kind of dump their shoulder forward. And that also puts a lot of stress on the shoulder itself. So hip dominant kipping pull-up is one, probably the number one thing that leads to people having issues. Number two is lack of shoulder mobility so that they can't actually get into optimal positions.
And another question based off that is, when you have someone that is, say, a bodybuilder that wants to, switch over to the CrossFit side of things and introduce themselves to some very different movements from what are traditionally done in bodybuilding, and people have all this stiffness. I've seen a lot of people just say, forget it, I'm not going to do it. But what is your experience seeing someone kind of adapt over time? Because I'm someone that came from that background and went into Olympic lifting, and it took me quite some time to get used to those movements. And for me, it was just a matter of, I don't think I actually did a ton of mobility work specifically, but it was just get her under barbell and do, controlled reps and breathing in the hole of an overhead squat and things like that. So are there certain things someone should think about if they're trying to get into CrossFit from bodybuilding and they just feel stiff all over and truly are kind of stiff, that, might not just be foam rolling on a lacrosse ball or something like that?
So certainly there's a lot of people that are going to get a lot more mobility simply by just starting to train in that mobility that they haven't accessed that will help them. They may not need to do a specific mobility routine to improve their motion, but there's also going to be a lot of people that when they start jumping in those movements, they practice their overhead squat for a few weeks and it's not getting any better. And then they actually need to start thinking about, how do I actually go about creating a mobility routine that will address these areas that are off, since just doing the movement patterns themselves aren't helping. And I'd say the biggest thing that I see people have an issue with is that they just assume that where they feel tight or when they're doing a movement where the tension is what's actually tight. So that may not make sense. So let me explain it a little bit. If you're doing an overhead squat and we have really stiff ankles will mean that you probably need to lean your torso further forward as you squat down because you can't push your knees forward. That's not that bad for a back squat to have a forward torso angle, But if we're now trying to stabilize a weight overhead, a really forward torso angle is going to make our shoulder go to a much more extreme position to keep that barbell over the middle of our feet. And so that person might feel like their shoulders are tight, but that's because their shoulders may be compensating for lack of mobility somewhere else, such as something as far away as their ankles. Or if we look at somebody's front squat, if their ankles are stiff, a lot of times people will complain that their hips feel stiff. Well, they go through more motion in their hips because their ankles are stiff. So don't just assume that where you are tight is where you're actually tight, or excuse me, don't assume where you feel tight is where you're actually tight. You want to take the time to actually break out your mobility and figure out where you need to spend your time. Because when you prioritize to those things that actually need your attention the most, you can make a lot further improvements in your mobility.
Yeah, I always tell people the ankle is the silent killer of
Oh yeah.
any any Olympic lifter, power lifters, hip pain, upper back pain, whatever. So, um, and then are there screens or something that you have that people can do for themselves to make sure they're ready for some of these CrossFit movements?
So I actually believe, like, if we talk about a pure screen, like testing your blood pressure is a screen. The screen is to do the movement pattern and see if your positioning looks good underneath the eye of somebody that's familiar with those movement patterns. So pull an empty PVC pipe out and have your CrossFit coach take a look at it and see if they can coach you into better positioning. But if after you do a screen, y'all realize that, what I have from a mobility perspective in XYZ movement is not enough, and now I need to break it down into the things that are specifically holding it off, then yeah. So if you go to performanceplusprogramming.com/ultimate-mobility-checklist, that, or you just send me a DM on Instagram or email. That is a free thing I put together where we basically took all the basic movement patterns that CrossFitters, Olympic weightlifters, and powerlifters see. And we said, okay, if you can't get into good position in your overhead squat, run these 5 tests. If your front rack sucks, run these 4 tests. And so we help you break it out yourself so that you're not spinning your wheels working in the wrong areas.
Mm-hmm. And another question I have for you here is, you have a degree in exercise phys, probably, or
Exercise
science?
and sports science.
Okay, yeah. So, what are your thoughts, again, seeing kind of traditional principles of strength training and then what CrossFit is doing? What are your thoughts on Olympic lifts being programmed for maybe more than 5 reps or so? Because in the weightlifting world, that's typically a no-no, where it's too technical of a lift. There's too much at risk. People will say your form's going to break down. And you're going to get too fatigued. And you being a physical therapist and someone that's on both sides of the ball, what are your thoughts on that?
Well, where you typically see the Olympic lifts programmed, or how you typically see them programmed in CrossFit, is kind of 2 different areas. You typically either see the pure heavy strength work that's going to be programmed very similar to how an Olympic weightlifter would. Let's show up today. We're going to build up to a 3 rep max snatch, or we're going to do 6 sets of 3 at 75% of your 1 rep max. Or we see it show up in a metabolic conditioning workout where those reps might be higher, but you're going to see that weight be drastically lower. And so I can understand, like, that maybe we're not in a Metcon throwing in snatches at 90% of your 1 rep max, because that's going to be really difficult to create that force output under a high level of fatigue and maintain form and positioning. But when we're talking about somebody doing a workout where they're doing 30 snatches with 95 pounds, and that 95 pounds is appropriately scaled to them because they're somebody that already snatches over 200 pounds, then I don't have an issue with them doing that load that's less than 50% of their 1 rep max for volume and speed and intensity, as long as they're able to maintain decent form as they go through that, which is what CrossFit's all about. They want you to master the mechanics of movements, then consistently reproduce those mechanics, and then add intensity to it. So CrossFit itself is not going to say, hey, today's your first day snatching. Guess what we're going to do? We're going to throw 95 pounds in the bar and you're going to snatch that 30 reps. Instead, we would find some substitutions for that workout for that individual on day 1 while we dial in their mechanics and consistency.
Yeah, makes complete sense. And um, are there preventable injuries you see in CrossFit that people could be addressing on their own before, these things happen?
Are there preventable injuries that people can get ahead of? I think overall, if we just understand that most injuries just happen when we ask the body to do a lot more than it was prepared to do really, really quickly. So if you're jumping into CrossFit and you have not been working out at all in a while, then you just need to communicate as you join that gym with the coaches there that like, hey, this is my first reintroduction to exercise. So how should we plan this out? Like how many days a week should I go if I'm just now starting? How intense should each day's workout be? And in general, they're probably going to say, look, you're just starting out. Why don't you come in 3 days a week for the first month? After a month, maybe we bump that up to 4 days a week. And we kind of take this slow lead into upping volume. Where I see most injuries happen is, again, like people do too much too soon. People jump into, they're a CrossFit athlete. They feel like their strength is holding them back. So they jump into something like a Smolov squat cycle, which if you're not familiar with the Smolov squat cycle and you're listening to this, high intensity, high volume, high frequency squatting that was basically written for Russian Olympic weightlifters back when the USSR was kind of dominating that sport. And those athletes' lives and supplementation regimens all revolved around having them have as much available energy to recover as possible from high volume working out. You and I probably don't belong doing Smolov squat cycles in addition to going to CrossFit 5 times a week.
Yeah.
We have full-time jobs. We have other responsibilities outside of life. So asking our body to do a Smolov squat cycle might not be the best move unless we compensate for that by cutting our volume somewhere else and making sure all of the other lifestyle factors that we have going on are dialed in. Just be smart about adding stuff in.
And what Zach is really saying is they're all on anabolic steroids and heavy drugs to elicit a strong adaptation, but they can also recover a lot faster than a normal human being with a 9-to-5 job and that might be, 35 years old or so. I just had a patient the other day too that just had a spinal fusion, and we had her on a program. She was doing great. She got back to barbell squatting and everything else, and she's a bodybuilder, and she didn't like the progress. She wasn't loving the slowness of the progress of, well, you're 3 months out and you're barbell back squatting, but yeah, you have metal rods in your back now. Like, we want to respect the healing process here. And she went on and so she went off my program and went on someone else's, and then came back and was like, yeah, I'm really hurting, whatever. I was like, well, what does your programming look like? And it ended up being her knees that were bothering her. And she was doing a Dana Lynn Bailey, who's a professional bodybuilder, doing one of their workouts. And I'm like, you're 50 years old. You're not Dana Lynn Bailey. You're not on drugs. Like, how did you think this was going to work out for you? And she's smartened up and she's back on my programming now because she was still making progress. But yeah, that's one of those things. People just go out and do all these things. And it's like, why? You're not, going after these elite athlete programs that are online. It's like, it's not built for you.
We want to be constantly providing a progressively overloading stimulus because that's what's going to drive adaptation in the body. But what we have to realize is progressive overload is just more than what you've been used to doing. So if in the last 3 months after a spinal fusion, you're used to doing very little, it doesn't take a whole lot to still provide an overloading stimulus for your body. And that's actually a good thing. Let's take advantage of this time period where the body's actually going to be really, really sensitive to low amounts of volume. Since you've done none for a while, you're still going to get a positive training effect from that low volume. If you jump that volume up super high, now you only have going even higher and even higher and even higher to continue to drive adaptations.
Yeah. And so people that have had previous injuries, it's an interesting place for people to be. And it's something I see all the time and I educate my patients about. You might be able to say the same or something different, but I tell people when they're rehabbing through an injury, there's this kind of volatile state where if it's somewhat acute and short-lived, it's like, hey, this person still has all their strength in physical adaptations for the most part, where they still know how to push it. And there becomes a point we get you out of pain, but that shoulder or hip still isn't ready for the volume you were doing before. And it's like sometimes you have a really successful session and you get someone out of pain, and then they're like, oh, I felt good, so I went and I crushed my squat workout, and then they hurt themselves again.
Yeah.
And it's
a big part of that is that overall athletes need to be finding professionals to work with that are really good at helping people modify their activities so that they maintain, when an area is injured, as much fitness as possible. Now, there are going to be certain periods of time where that is a complete impossibility. After that spinal fusion, you couldn't load that patient up at all in terms of spinal loading for a period of time due to their post-op restrictions. But anything we can do when somebody's injured to at least maintain as much tissue fitness, both to the injured tissues and those around it, the better off we're going to be and the easier transition we're going to have in that time period where things are kind of, the door's still cracked open after that injury is calmed down, but we still haven't had enough time to fully build strength back up.
Yeah, one of the things I do with a lot of my patients, just to kind of keep it simple for them, simple for us, is just add one movement per week for like 3 sets of 5 and see how it goes. And then build it up to, depending on the movement, maybe 3 sets of 8, then 3 sets of 10 week by week. And I find it be a really simple way for people to follow along, feel like they're making progress, and they're not just overloading everything. Because the other thing is too, if you go in, your shoulder feels good on one day, and you throw 4 exercises at, and you feel pain after,
Yeah.
we don't know which one did it.
Yep.
So one of my big things there. And then what are your thoughts too? GHD sit-ups, another big controversial topic in the CrossFit world. Of you see people kind of, bringing, they're sitting up on a GHD face up, and then they're dropping their head almost down to the floor in full extension, and then coming up and trying to touch their fingers to their toes. Something in the physical therapy world, people, their heads roll on. But Zach, you have a very different perspective here, so I want to hear your thoughts on the GHD sit up.
So I've not actually had a whole lot of people give me kickback on GHD sit-ups. I've certainly gotten plenty of kickback on a lot of other exercises, but I mean, I don't have any issues. I love glute ham developer sit-ups. They're probably one of the tougher exercises that there is out there in the abs, because if we think of so many of the movements we do targeting our rectus abdominis or just core in general, focuses on neutral or like neutral to a flex position. We don't very often train the spine going into extension and moving out of extension, which is what the glute ham developer sit-up is. And we very rarely have issues with training muscles and joints through their full range of motion. But for some reason, when it comes to the spine, people get all kinds of freaked out, and they're going to say, all right, glute ham developer in that back position, everything's in extension, then we go to flexion, and they're going to have an issue with that. I think that's outdated thought process on the human body.
Even if they're
hashtag glass backs. Yeah. there's a guy. Do you know Deadliest Lift on Instagram?
No.
It's like my favorite current social media platform. It's just
like a meme page.
Strong man who just does all these random deadlift variations. Like he'll stack up bumper plates to be like 2 feet off the ground, and he'll do a camber bar deadlift where he stands up and he has to remove the ceiling tiles from his ceiling because he actually stands up into the ceiling with it. He just does some crazy feats, and he was using the hashtag glassback because he gets so much hate on his posts. And I've started using that. Anytime somebody gives me a little bit of crap on an exercise that I post or talk about, I just go back with them, hashtag glassback.
Yeah. And so now, do you like having people do that in a more controlled range of motion? Because I see people do them explosively all the time too. And it's like, are we demonstrating?
I use it both ways. So, if we're talking about in a workout where our goal is to challenge the abs underneath a high level of fatigue, like a metabolic conditioning workout would, then let's go fast with it. But I also think there's value in at times going really slow. Like I love doing that with people that have tight hip flexors. Let's do an eccentric GHD sit-up where we take the hips and the abs through full global extension, which is going to really elongate our hip flexors. And then let's ask them to contract and pull us out of that position.
Okay. And so you mentioned that. So what are the exercises that you get a lot of hate for?
Jefferson curl variations. I did another physical therapist did a response video to one of mine where we were doing a glute ham developer back extension. So you're on a GHD facing the ground with your torso off the glute ham developer, and you simply round your back forward and extend it up. I was holding a medicine ball that was 20 pounds, but he was saying that rounding and extending the spine, when you don't even have that much compressive loads on it because you're parallel to the ground, was going to destroy my back and result in me needing to have surgery. Those were his exact words. That is the biggest form of glass back there possibly ever is there.
You're going to have to tell me who this physical therapist is after.
I reposted it, so you can go on my page and find it, but I didn't tag him just because I didn't want people following him. All of his posts are the same, like fear-mongering, terrified of movement type stuff.
Yeah. Yeah,
That and
there's
Jefferson curl variations are probably by far the two that I get the most hate on.
yeah. And so Jefferson curls, yeah, they are a contradictory topic in our field still, even though we now should all understand that the spine can flex even under load. Um, what are your thoughts on using Jefferson curls in someone that has had, sciatica, disc herniation, things like that, where um, we're trying to return them to deadlifts and things?
So I was very McKinsey trained when I first came out of school,
Same.
and I really like the McKinsey method as a great way to get people doing basically non-painful movement in an area that's painful and pumping a bunch of fluid in the area to dilute some of the chemical irritants so that things feel a little bit better. But one thing that Robin McKenzie, the creator of McKinsey method, really emphasized was at the end of a plan of care, you have got to restore that direction that was previously not what they call the direction of preference. So let's say, you had what most people would consider what I would call flexion intolerant back pain with radiculopathy, where rounding your back forward creates back pain and or leg symptoms. If it responds well to taking your spine into extension and that relieves your pain, at a certain point, we have to start adding in flexion again so that your body's not so sensitive to that movement pattern anymore. And I think the Jefferson curl is one great way to go about doing that. It all depends on somebody's irritability and how they're responding to loads, positions, and activities at that time. Like if somebody had screaming 10 out of 10 shoulder pain when they got to in range of an overhead press, am I going to have them overhead press through full range of motion? No, neither would they want to because it hurts that much. If somebody has highly irritable, flexion intolerant low back pain, am I probably giving them Jefferson curls? No, but down the road, once we get that irritability down, I want to reintroduce that, load it up, and have the body prepared for when at times it's going to get into that position. Am I doing a Jefferson curl with 405 pounds? Probably not. But I'm not scared of having somebody do that with holding a 50-pound kettlebell because we get out of position in life. Like go pick up a bag of dog food that's flat on the ground and show me a perfectly neutral spine position as you do that. No, it's got to flex to do that. So
Yeah,
that's training the body to be prepared for that.
absolutely. I had someone the other day that read a book about animals written by a physical therapist a long time ago. And there's the archetypes and everything, and he's an engineer, and he fell into this thought virus, I guess, of just things have to happen a certain way, and if they don't happen that way, I think he put himself in pain, mentally, because if he felt something just shift a
Yes.
little bit or whatever, he was all out of place and things weren't moving and this wasn't locking at the same time of this, yada
Yeah.
yada. So we've been trying to work him out of this, and he's a hockey player too, and uh, he came in with back pain. We got him out of back pain. We just basically showed him how to control his spine through a range of motion. And he's like, "Oh, I'm going on a mountain biking trip." He's like, "So should I be thinking about like where I'm placing my hips, and like is it okay for my knees to go forward while I'm pedaling and this?" And I was like, "Dude, just don't worry about falling off the bike or hitting a tree." I was like, "You play hockey, so that doesn't happen in a vacuum. There's plenty of positions you're going to be put in by other people without your own influence on it, and you have no
Yeah.
control over it sometimes. Uh, and you think that's okay, but you're scared. You're literally scared of getting hurt riding a bicycle from your positioning, where it's just like we have to just build exposure to load and tolerance. And yeah, everything can move. And um, there's some great
I,
studies that go ahead.
I love treating engineers because so often they come in like that and you really just got to get them instead of focusing on this right way to move, teach them to track their own asterisk signs. So one thing that we're at the Institute of Clinical Excellence, what you've referred to as ICE, company that I teach continuing education for, we're just huge on, we don't do a good enough job of gathering appropriate asterisk signs to track somebody's symptoms. And so engineers really grasp onto this idea of tracking their asterisk signs. So earlier we talked about somebody that had highly irritable back pain. When they drove from home to the clinic to come see you, that 10-minute drive took their back pain up to a 7 out of 10. We're tracking a measurable, observable data point that tells us session to session, day by day, if what we're doing is having an appropriate effect on the things that we care about because we're tracking several different of those asterisk signs. I just like to get those engineers, don't worry about how you move, track your asterisk signs. What happens to your slump test when you do this exercise? What happens to your forward bend when you do that movement, etc.? And that tends to reshift their focus, and they start to understand, okay, none of these movements are bad. It's just about the volume and the intensity of it that can irritate my symptoms a little bit. And when they grasp that, they become so easy to treat because they come back next time and they have the most detailed
Spreadsheets.
notes for you. They got a spreadsheet of their asterisk signs and exactly what happened. And it makes your life as their treating therapist so much easier. Engineers are probably my favorite people to treat.
Yeah, I've done that
You got to
before
get past
too.
that visit one where they're a little obsessive about small, minute details, but then man, it gets beautiful.
Yeah, if you can use that strength with them to, because they all love data and they all love
Yes.
it's a scientific experiment. So,
Dude, it's
um,
so funny. Like they come back visit two and they're like, hey, I've been testing that thing we did. Like I didn't even tell them to test their slump test between sessions. And they're like, I noticed that every time I do this, that little nerve test we did, it got better. Or every time I did this, it got worse. And I'm like, I didn't even tell you to track that. And they just naturally started to track it themselves. It's so much fun.
yeah, I've also seen that go bad too, where someone was like continuously same thing, retesting their slump. I'm like, okay, but that's an irritant still. We can't just.
You for sure can overdo that as well. Yeah.
I was like, we'll get you there, and we can do some nerve flossing later on. But like, let's desensitize you first.
Yeah.
Um, and so, what are some other things you tend to find that are maybe more unorthodox as a treating physical therapist for people that are strength athletes, barbell athletes? Are there other certain metrics you're looking at with people?
It's a very broad question. Do you have a more specific thought there that you
No,
want to
you were just
discuss?
talking about how testing an asterisk sign like with an engineer and things, and um, I, I guess
I guess
another.
the thing that comes to mind with that is that fitness athletes, CrossFitters, powerlifters, Olympic lifters, people going to like boutique fitness gyms, they absolutely love going there. And it is one of the best parts of their day. And they are so motivated to find ways to continue to be in it, even if that means that they have to modify a little bit. But that is just the most fun part about treating them is just their overall motivation that they have compared to so many other populations of people.
Yeah, I I have a good story with that one. So I have a weightlifting team and everything, and I believe the same thing. And if you are a CrossFitter, powerlifter, bodybuilder, weightlifter, and if you go to a physical therapist or the PCP and ortho and they just tell you to stop doing CrossFit because one thing hurts and they didn't even look at you do that one thing, they don't understand you and they don't care to understand you is my true opinion. And maybe they do care. They don't have the time and the resources though to be able to give you that care that you need as an athlete.
Mm-hmm.
And so I had a woman, she had an incredible story. So she came in, she's like 55 years old, super kyphotic, forward shoulder posture. She's been an engineer her whole life. And she was diabetic, she was overweight. And then she came in because she had shoulder pain doing CrossFit, trying to snatch. And I was like, she's never worked out a day in her life. And just started doing CrossFit at 55. And I had her come down on the gym floor, and some of my weightlifting team members were in there. And what, like, my team captain is looking at me. He's like, "Have you lost your mind? You're trying to make this woman a weightlifter? Like, what are you doing?" And he's like giving me the stink eye. He's like, "Brett's lost it." And I told him after, I go, she got into CrossFit with her son. Her son lost 80 pounds. She's lost nearly, I think it was 75 at the time. She
Yeah.
kicked her diabetes. She did all
Right.
this. And like, this is what's keeping her overall healthy. And if
Mm-hmm.
she wants to learn to snatch, even if it's not perfect right now, I'm going to do my best to get her
Yeah.
there.
I would take that shoulder pain that she has with snatching any day over diabetes and that 70 pounds that she wasn't carrying prior to CrossFit.
Yeah.
We worry about rotator cuff tendinopathy way too much compared to diabetes, heart disease, and chronic diseases that are killing 7 out of 10 Americans.
Yeah, exactly. And it's like, it wasn't even that bad of a pain. And it was more, I think she just needed more time and attention and some slower learning and just needed to learn just basic coordination, and we did a lot of different things, but we got her back to it, and she got back to CrossFit, and she's still doing it now. I
Awesome.
think 3 years later, because she just checked in with me. So, um, yeah, for anyone, it's just I don't understand why we still do this as a medical profession. Do you know why they just tell everyone to stop doing things without even taking a look at it? I have runners all the time too. Doctor just told me stop running. Did they look at you run? Even physical therapists. I had someone with knee pain that had been to like 3 physical therapists,
I
and
don't. I
I
don't
was like,
think
did
that
any one of them actually get back to watching you run?
it's
No.
so hard for us to say like that. It's that they don't want to, or they're not skilled enough, or whatever. It's that those people are doing what they truly believe is best for that patient in front of them. They just don't have the knowledge and skill set right now to provide the best possible. And at times that can also be because of the setting that they're in. If you're seeing your primary care doctor and orthopedist, they have 6 minutes. So of course they're not watching you run, but hopefully that they are skilled enough and knowledgeable enough that they know a local physical therapist that they can then refer that runner to. Instead of saying stop running, they can say, hey, here's the diagnosis. If we need to do some sort of like medical intervention, here's the medical intervention we would do, but go see this therapist over here, because Brett knows how to adjust your training volume. He knows how to change your running gait a little bit based on this diagnosis, and how to strengthen those tissues up so that it can tolerate what you want to do. It's more just, I think, a lack of general knowledge of that stuff than a
Yeah.
actual trying to screw somebody up.
Yeah. No, I don't think they're trying to screw anyone up. If anything, it's just it's a blanket term to say, if you want to stop this, just stop doing that whole thing in general,
Yeah.
which doesn't do as much justice of, there is a whole plate of tolerance thing too, where if it's under a 4 out of 10 and it's not getting worse and you can maintain it, like, are you doing damage? A lot of the data says no.
Yeah.
So should we be telling people to stop doing these activities just because they have a little bit of pain, but they're doing a hell of a lot of beneficial there's a hell of a lot of beneficial side effects to running and crossfitting and doing all these other things that are preventing all these other comorbidities
Yep.
that we're seeing as a nation.
Yep.
So yeah, it's some interesting stuff there. And so do you guys, I mean, you guys are getting pretty big as a educational organization.
Mm-hmm.
Is there anything you guys are doing, like working with primary care docs or anything, or surgeons and physicians?
We have partnered with Wild Health at the Institute of Clinical Excellence. So Wild Health is a bunch of doctors that are taking a much more progressive lifestyle based approach at helping to cure people's issues. So they really complement a lot of what fitness athletes are doing in terms of thinking of staying active, proper nutrition, that sort of stuff. So they do like genetics testing to kind of understand a little bit more what your body responds to well versus what it doesn't. So we work a lot with Wild Health, and we've also been in some discussions with some other organizations that we can't talk about yet, that I think will get us more and more to where we get more fitness forward clinicians helping out fitness athletes, that they're not given those generic bad pieces of advice like don't let your knees go over your toes, or deadlifts are bad for your back, or you should just rest, those sorts of things.
Yeah. So where is this? Is this Wild Health organization just kind of like some national organization? Are they in a certain part of the country, or?
Yeah, they're a national organization. So basically, if you sign up for a membership there, you get teamed up with a physician and a lifestyle coach. So you have a whole team of people to work on your overall health.
Oh, so is this like a telehealth type thing?
Yeah.
Oh, okay. Interesting. I've never heard of them. And then anything else you really have, Zach? You were pretty concise on your answers, so we didn't take too much time today, but those are all the questions I had. Anything else you want to talk shop about?
No, that's good.
All right, man. And so, Zach, where can people find you again, just so they can check out all your awesome content you put out?
Main websites are thebarbellphysio.com is kind of my personal blog. My business website, where we have different training plans and things like that, is performanceplusprogramming.com. And then clinics, we got 21 clinics around the country. Those are at onwardphysio.com.
Awesome, man. Well, thank you so much for coming on, and hope everyone enjoyed the barbell therapy, talking with barbell physio. And I think there's a lot of things we think in parallel with. So thanks for coming on, and it was great to
Enjoyed
hear
it.
your thoughts on some of the things I had undetermined about CrossFit, and open my eyes to another different perspective. So
Awesome.
appreciate it.
Cool.
All right. And we are out.